Okay, so if I introduce Kristin Arnadottir first. Now Kristin is with the Permanent Commission from Iceland to Vienna, and she has a long and distinguished career in public service and diplomatic relations. I'm not going to go into everything because it's extensive, but her current role is as the permanent representative of Iceland designate to the OSCE, the Organization for Security and Cooperation in Europe, the IAEA, the CTBTO, and the United Nations Office, Vienna. So over to you, Kristin.
Thank you very much, Emmett. And dear all, let me first at the outset thank you for being here with us today, and I welcome you all to Vienna, even if virtual reality cannot do this wonderful city justice. It is a pleasure for me to team up with Planet, phone starting to ring. It is a pleasure for me to team up with Planet Youth and Professor Inga Dóra Sigfúsdóttir again, since we collaborated on developing the research model that we are discussing here today in the capital of Iceland, Reykjavik, some 23 or 24 years ago. At that time, we were domestically dealing with a huge rise in juvenile consumption of illicit substances, and the fact was that the methods used to scare children away from drug use and our youth in general were not successful. So the journey started with developing a research-based approach to deal with and explore which protective factors could prove effective. At this time in European history, we were witnessing turbulent times, social unrest all over in the wake of the collapse of the Soviet Union, migrant flow of people seeking new opportunities out of poverty, and new channels or routes of drug smuggling into our markets, so to speak. These were challenging times, and we were all very much aware that this foe respects no boundaries. The reality everywhere is that young people are targeted by drug dealers, and this is a rapidly growing problem all over the world. Our societies are different, but in essence, families are the same everywhere, or at least have some essential elements in common. And now it has not only been scientifically proved in Iceland that the method of focusing on enhancing social capital through protective factors is relevant and serves its purpose, but the approach is being used all over the world, adjusted and advanced. Who would have believed that back then? More and more communities are using what has become known as the Icelandic model, and more it is being recognized that research-based methods need to be the foundation for efficient results. That is why we are here today, mainly to compare notes, I believe. And sadly, we are in the midst of turbulent times. A war, Ukraine, has been invaded by Putin's, something happened here unexpectedly. And I was saying, Ukraine has been invaded by Putin's army, and a society of 44 million people are under attack. Millions of people are fleeing, and the biggest humanitarian crisis in our times is in front of us in this part of the world. Social unrest will follow, and there are those with bad intentions that will try to make the most of this situation. And we must realize that measures have to be taken to protect our most vulnerable, including the children and the youth that might be easy targets. While we set out strategies to react to this horrible reality, we must strengthen our preventions strategically as well. The Icelandic model is one of the tools that we have. While I welcome again Professor Inga Dóra Sigfúsdóttir, who came to Vienna to carve out things with us, I am now going to give the floor to her and ask her, Inga Dóra, is the Icelandic model valid in all the different circumstances, both here in Europe and elsewhere?
Thank you so much, Ambassador Arnadottir. This is a very good question. And Christine, because we've been working on this together for years. Christine was one of the strong political leaders when we were starting to carve out the Icelandic model over 20 years ago. So she asks me if the Icelandic model is valid in other circumstances. The short answer is yes. But before I explain that in more details, I need to say, together, throughout Europe, Latin America, Africa, the world, we share grave concerns. Substance use, and in relation to that, a list of other sad things: self-harm, suicides, delinquency, for example, are large-scale problems. So the fundamental question is, what can be done? We may agree that the obvious answer is simply to eliminate substances in any form. And governments around the world have tried this for years, for decades, for centuries, using different methods in fighting creation, distribution, and sales of drugs. Alcohol prohibition laws, taxes, regulations, increased prison sentences. The focus has been on fighting supply. Success has been incremental, if any. But a second answer tackles the issue from another angle, namely driving down demand. It calls for more long-term thinking, but the results are also more rewarding. This is the way that we have chosen to go in Iceland. We started in the 90s, and the good news is that during this time, we have learned that it is possible to prevent bad things to happening to young people. Substance use among Icelandic youth has been decreasing constantly since 1998. When we started in the 90s in Iceland, our focus was Iceland. A downtown full of dead, drunk teenagers, accompanied by violence, sexual assaults, and other problems. The Icelandic public craved for changes. We have been trying to prevent it, like Christine mentioned, with methods that did not work. We obviously needed a different strategy. At the time, a visionary group of researchers, policymakers, and practitioners came together to figure out a new way of dealing with the matter. First, by relying on evidence. Second, by focusing on communities, changing the circumstances around the kids and making it easy for them not to have to use drugs, instead of putting the responsibility on their shoulders. And third, by having researchers, policymakers, and practitioners working together. At the time when we started, we were focused, as I said, on Iceland. We were not thinking of the whole world. Later, when the world figured what was happening in Iceland, people asked, can this same model work in our place? And we started working through ICAR in cities around Europe. And of course, the same model works all over the world. The reason is pretty simple. Kids are all the same. Everywhere we go, parents are all the same around the world. We tend to want the best for our children. And no child at the age of 7 has intentions of later becoming a drug addict. They want to become teachers, lawyers, coaches, cops, farmers, hairstylists, but no one says, I'm going to become a drug addict. On my mind and in my heart for the past months have been the parents I met in Mexico in the beginning of last December. Some of them crying, asking us to assist them in saving their kids from becoming substance users. living in cities where drugs are offered to kids on every street corner. Today, of course, as with all of us, the parents and children in Ukraine are also on my mind. People going through horrific trauma, having to flee their homes, their country, leaving unresolvable scars that make young people more vulnerable to the use of substances than if living in security, integration, and being able to enjoy Ukrainian wonderful educational system. Dear colleagues, I look forward to hearing from Yvonne, who brings us a valuable perspective from Kenya, and my good friend Carlos Charme, who will give us insight into how the Icelandic model is being implemented in Chile, as Chile was the first whole country outside of Iceland to implement the model. And then, of course, my wonderful European friends and partners, Margaret Lilja, Giovanna Campello, Kristina Sperkova, and Mate Koshir. So Africa, Latin America, Europe, a perfect combination, because we know that the only way we can do this is by collaborating across borders. In a world where there are practically no cultural or national boundaries anymore, and cyberspace is without limits, in this kind of world, it is only through joining forces, by learning from each other, and by basing our work on evidence, will we succeed in creating better lives for young people. It is not an easy task. We will not change anything by single project solutions. Prevention needs to be long-term, consistent, and comprehensive. It is not one campaign. It's more like a quiet revolution. Thank you.
Ingadora, thank you very much for that. We'll move swiftly along, and I'd just like to remind people that we are kind of tight on time and we've a packed agenda to try and get through in about the next 35 minutes. So I'm going to pass you over now very shortly to Dr. Yvonne Orlando. Yvonne holds a doctorate degree and an MSc in clinical psychology from the University of Nairobi, and she's currently director in charge of public education, advocacy, counselling, and rehabilitation and regional coordination at NACADA. So you're very welcome, Yvonne. You could give us your comments.
Thank you so much. And good morning, good afternoon, and good evening to all colleagues who are listening in. It is indeed an honor to be part of this event, which is themed Increasing Social Capital through Protective Factors of Drug Use Initiation. And it gives us great pleasure to participate today, particularly considering the impact COVID-19 has had on the world drug problem and particularly our youths. As a government entity mandated to coordinate the country's multi-sectoral response to the challenge of drug trafficking and abuse, the National Authority for the Campaign Against Alcohol and Drug Abuse in Kenya, NACADA, reviewed its programs in order to address social and COVID-related challenges and limitations. As you all know, COVID-19 brought about many social issues. We had the lockdowns, school closures for months, even years in some of the African countries, and of course, you had social distancing. This brought about limited interaction with family and friends, and we know particularly sporting activities were closed down, and these are the activities that keep our children and youth majorly engaged. To ensure increasing social capital through protective factors of drug use initiation, NACADA undertook the following. We conducted a nationwide mass media program on positive parenting to increase parental support, to screen and to bond as a family. This was broadcast in several of the national TV stations, digital media, and social media. The program garnered support with millions of viewership. To engage the children during the period, we conducted an essay competition for school-going children. It was themed Art and Essay National Competition 2020, Stuck at Home During COVID-19. This is my story. And this was intended to increase the self-esteem of the children, as well as to keep them engaged. The winners were recognized during IDADA in June 2020. We conducted virtual trainings for prevention and addiction professionals, both in the public and private sector. We also supported strong neighborhood attachments by partnering with the Kenya Alliance of Residents Association to ensure that the neighbors came in together to offer the social protection. During that time, we also experienced some challenges. We had increased domestic violence cases. These were reported and documented to be higher than any other time. We had parents drinking at home, started drinking early than they usually did, and they turned the boots of their cars into bars. There was also misrepresentation of substances of abuse. We found the media glamorizing drugs, and therefore some of the youth felt like if you're not drinking, then something was wrong with you. This ensured that NACADA tried as much as possible to bring in the communal aspect of intervention, and of course, the family was made the pivotal point. As I close, I'd like to emphasize on the need for all of us, and particularly policymakers, to address the stigma of substance use, and of course, to initiate prevention and mitigation programs that are holistic. We also are looking for support for capacity building of all our stakeholders. Thank you so much.
Thanks very much for that, Yvonne. Moving swiftly along, I'm going to introduce you to Carlos Charme Fuentes. And Carlos has a degree in legal sciences and is a lawyer. He studied at the Universidad de los Andes, and currently, and since 2018, he's been working as the National Director of SENDA, where amongst many other things, he's been responsible for the implementation of their national prevention plan, Elige Vivir Sin Drogas, which in 2022 is being implemented in 100% of the communities in Chile. So thank you, and over to you, Carlos.
Thank you very much, Emmett, and good morning to all that are listening to us. Let's begin with our presentation. Si la puedes abrir entera para que yo pueda leer bien. Yes. Yeah. Look, we have a three-part introduction, the diagnosis of the Chilean reality, and which is the national plan Elige Vivir Sin Drogas that is based in Planned Youth experience. Look, in Chile, we have 16 regions and more than 346 communities. And SENDA has the service that I am the leader in this time. It's in over 100% of the regional coverage at the 16 regions. We have 70% of our teams are working in the 239 communities, more than 1,000 professionals working in this Planet Youth, SENDA, Elige Vivir Sin Drogas, and we have 6 main prevention programs, 7 treatment programs, and 1 social integration program in all our country. Look, our coverage of these programs, prevention and also treatment, we have a 96% of coverage on of school population nationwide. More than 200,000 survives that has been answered by students in Chile. It's a huge number, we think. More than 6,700 educational work and social communities are beneficiaries each year. More than 2 million of students, fathers, mothers, adults, and teachers and key actors are participating in these organizations and benefit each year. And we have made more or less 400,000 alcohol tests and drug test controls in 2019 to the date. But you know, we here in Chile, we have a huge problem. One of our main problems are that our youth between 13 and 18 years are the first people that smoke tobacco daily, marijuana, cocaine, pasta base, and sedatives of all American continent. When I say all American continent is United States and Canada also. And what we have done with this huge problem, we have looked to all the world, which is the based evidence most effective programs that we are implementing. And that's why in 2019, we brought here the Planet Youth experience that we gone in 6 municipalities, and then we in the 1919 we increased to 46 municipalities, and this year will be on all the country. This program is has 3 phases. Phase 1, that we made the diagnosis, and more than 200 community, 2,000 establishments, 200,000 survives, 73.7 response rate, and more than 96 population in this diagnosis. Then the second phase, we made the programming, articulation, and intervention. And in the phase number 3, we do less the monitoring and evaluation of these results. And we have what we have seen in this more in these surveys. When we cross prevalence of substance and risk and protective things, we can you can see here something that is amazing. Look, when you compare the smoke daily, getting drunk in the last 30 days, and marijuana in life, when the children are under parental control, and when you compare with high parental control, the difference is also a huge difference. That's why we think that it's positive parenting is a clue thing that you have to see, because the evidence shows that affectivity and involvement, settings, rules, and limits, monitoring, and supervision are protective factors. And I think personally, this is the most important protective thing that we can do. Then when you cross prevalence of substance use according to whether friends use the substance, there is also a huge difference between when friends do not consume, between when you compare what friends consume. Peer group is also a key development, positive leadership between young people and their abilities to resist the social pressure that peers can bring to bear in this area. And when we see, and we have studied what is the principal risk factors and protective factors, you can see it here and in the other annexes. Sorry. Now, what we have done with these results? We have analysis and which are the protective and risk factor in each community. We have the regional and community roundtables that they have done the prevention action plans, and then with these prevention action plans, they go to the formation of school-based roundtables and also the prevention plans in that schools. Finally, what we think are the 5 key aspects in this program, Eligibility sin Drogas, is 1, we have to provide tools to improve the team's analysis of results so that they can transmit them effectively to the communities. The second is they implement different approaches, both to the neighborhoods and the organization, authorities, community leaders, and etc. The third is to build self-management capacity in the communities, develop sustainable and comprehensive prevention strategies, and last, the flexible initiatives are motivating neighborhood, involving all the participation of all the key people that it's around the schools and the childs. Thank you very much.
Thanks. Thank you, Carlos. That was Carlos Charme giving us a great introduction, I think, and I'm sure you managed to get through that really well in the short time you had available, because the volume and the amount of work that's gone on in Chile is really, really impressive. And I'm sure you have huge amounts of data to drive all sorts of activities in the communities. So we're going to be moving on to the next section of this presentation, which is really looking at that. And Carlos, you teed this up very well, because we're going to be talking now very much about protective and risk factors. We have 4 speakers for you, right? And we're going to be talking initially about organized leisure time activities. Margaret Goodman's daughter is joining us. I don't think you're in Iceland at the moment, Margaret, but you very much involved with the Planet Youth organization in Reykjavik, right? Margaret holds a master's degree in sociology from the University of Iceland and is a lecturer there in the Department of Sports Science. She's also a data specialist and a lecturer at the Icelandic Centre for Social Research and Analysis. So thanks very much, and over to you, Margaret.
Thank you, Emmett. Actually, I'm in Reykjavik at the moment, and I hope you can hear me more than you can hear the storm that we are experiencing now in Reykjavik. It's actually feel a little bit like my window is coming through into my living room, but I hope my focus is going to be on organized leisure time activities, and this is more like a teaser, not a full presentation, but I want to give you a glimpse of what we see from our data. So we know, based on the Icelandic prevention model, we know that organized activity or organized leisure activities has a huge impact, and we look at it as a big preventive factor in our work, not only in Iceland, but also around the world. But we also see that that's something we maybe have to work a little bit more on when we are in a different country or different municipalities, because it has also been, it's a work that we've been working on here in Iceland for more than 20 years to build up a really strong preventive organized activity. I want to make it clear, it's not the facility that has a protective factor. It's not enough to build a stadium or to buy more football or violins. It's the adult professional in charge that is the preventive factor, so to speak. It's the coach, it's the music teacher, it's the art teacher, the employee in the youth club, and so on. And I think that's really important. The role of organized leisure time activities in Iceland have become an important socialization agent here. And the municipalities found participation fees for children and adolescents. We call it the leisure card. And we see good example, similar all around the world. So it's like giving amount to parents from children 6 to 18. And also one thing that's quite unique, there is room for everyone. And last time I counted, we have more than 500 courses of all kinds of activities here in Iceland that children can choose from. So based on the Icelandic prevention model, and you probably know this figure, we've seen the numbers going down, but at the same time, we have seen numbers going up. And here I'm showing you trends in formal sport participation among 14 to 15 from 92 to 2020. So while the substance use is going down, we see trends in formal sport going up. And it's really remarkable to see that, and not only have been working on, getting more and more children to participate, but we have also managed to organize in a different way. And when we look at sport and substance use among the same age, 14 to 15, we see that children who almost never participate in or are engaged in sport in a sport club or team, they are far more likely to use any kind of substance. To put it in another way, we could say that the kids who are participating 1 to 3 times a week or 4 times a week or more are less likely to use any kind of substance. Doesn't matter if we look at alcohol drinking, daily smoking, cannabis, chewing tobacco, electronic cigarettes, and so on and so forth. And same we see when we ask them, do you take part in any organized leisure activities? Then we see that the kids who almost never participate are more likely to use any kind of substance. Doesn't matter what kind of substance, we always see the same trend. So the children that we are most worried about are the non-doers, non-participating. So that's one of the key issues here in Iceland, to make sure that we find some kind of activity that they like to participate in, because we see it has a big, big role. And we like to look at ourselves as sport nation, Iceland. We are few, but we have got some really good results. And we kind of tend to talk a lot about sport when we are talking about the Icelandic models, Icelandic prevention model abroad. But I want to make it clear, it's not only sport, but why we focus on it is because we have up to 90% of all children in Iceland that take part in sport clubs at one time or another. When they are 11 or 12, it's more than 80% of the cohort. We see the numbers going down, 15, but we still have more than half of the cohort participating once a week or more often. We have done some changes, like I said in the beginning, we've been working on this for more than 20 years now, and the role of the coaches, sport clubs, and the adults in charge have really changed. where the focus is on educating the coaches and the adults in charge, educate them about their role in the children's life, about how important role models they are. We also see a big difference in the role of the parents. And we know that parents are a key issue in the Icelandic prevention model. So they also play a huge part as volunteers, as supportive actors regarding the leisure time. And then the different kind of role models. To end, it's about changing the culture. Organized activity play a significant role within the Icelandic prevention model. And in many countries, in many municipalities, this is something that we really have to work on, but it will take time. We don't change things overnight. And remember, it's not a project. It's about changing the way we act, the way we think, and then act in a different way, so to speak. This was really short, 6 minutes, 4 seconds, Ahmed. I want to say thank you. Please don't hesitate to contact me with further questions. So that's all for me now.
And thanks very much for that, Margaret. You're good, 6 minutes and 4 seconds, very impressive. And thanks. And you actually, I think you teed up our next speaker quite nicely when you talked about parents there as actors in all sorts of ways, but certainly you mentioned them as actors in the organized leisure time space as well as volunteers. So I'm going to hand you over very shortly to Giovanna Campello, right? And just to give you an introduction there, she's going to talk to us a little bit about parenting in a moment. But Giovanna has more than 25 years of experience working with the United Nations Office on Drugs and Crime and supporting member states and stakeholders in improving their drug prevention response. Since 2016, she's been leading the prevention, treatment and rehabilitation section and promoting evidence-based, gender and human rights sensitive practice on drug prevention, treatment, care and rehabilitation, as well as access to controlled medicines. So I'll hand over to you and thanks, Giovanna.
Thank you so much, Emmett, and I would gladly give my spot back to Margaret and keep on hearing about her amazing data. But yes, there is a very important role for parents. Let me try and share my screen. How about this? You should be able to see
that's great,
my slides by now. Yes. And so I also have very little time to talk about the role of parenting as social capital. And so I want to start by giving you the spoiler. Parenting is a massive source of social capital that we need, we can, and we have the tools to exploit. And not exploit, to build on, because it's so important in the healthy and social safe development of children. And I'm coming in not so much from the epidemiology side like Margaret did, although I had some very good slides that shows how more parenting equal less use and less risky behaviors. But I'm coming in from the point of view of the standards, so that you know that they are the document where we have summarized what works in prevention. And among the interventions that have been found to be effective in preventing drug use, there are parenting skills programs. And these are programs that really are all about helping parents to be better parents. Just better parenting, improve that parenting. And as I was mentioning, they have been found to be effective in preventing drug use. But I also want to to draw your attention that they've not just been found to be effective in general, yes, but also in very difficult socioeconomic situations of low social capital. So for example, we have data that shows how parenting skills have been found to be effective in violent communities, in poor communities, among displaced populations, so refugees in this case. They are the kind of program that is more consistently benefiting both girls and boys, which is not the case for all prevention. And they do this again also in displaced populations. And they have been found to be effective by WHO also in preventing violence, particularly youth violence, and child maltreatment. I think many of you are familiar with the slides, that many of you that have listened to me speaking about parenting before, but this coming slide I don't get to present very often. And this is about how WHO recommends parenting programs. Look at that. So of course, WHO recommends this program to prevent child maltreatment and prevent youth violence, that I've said already. But they also recommend it to promote the development of children, including of poorly nourished, frequently ill, or otherwise at-risk children, and children of mothers affected by mental health conditions. WHO also recommends these programs to manage behavioral disorders of children and adolescents. So really, I think there is really strong ground for us to say that better parenting means really, really strongly contributes to the healthy and safe development of children and youth, also in situations of limited social capital. And the great thing about this is that we have the tools. We have the tools to help parents be better parents also in these difficult situations. So for example, you probably know our programs. For all families, we have Families United, but for families in difficult circumstances, I should just show you the data, we have Strong Families. And during the last couple of years, due to the terrible situation connected to the pandemic and to humanitarian emergencies, we have also produced resources that are available online. For example, on parenting during COVID, I think we have at least 40 languages in these resources. We have resources on parenting in emergencies, also together with WHO and UNICEF. And of course, we have our Listen First campaign that had a second phase that was all about parenting in stressful circumstances. It is positive, it is engaging. We have 10 videos and fact sheets with practical tips on all sorts of parenting possibilities. And all of these resources are on our website. It's really easy, unodc.org/listenfirst. But what I would like to conclude on is that, yes, sure, of course, we are super proud of these resources, but these resources are for you. They are for you all around the world that want to support the parents in your countries and in your communities, and reach not only all of the protective factors in the life of the children, so the community, the sport, but also the parents. And here you can see, yes, there is there are at least 12 countries that, and we have spoken with governmental organizations, non-governmental organizations, they come to us and they say, we are interested in these resources, and we are there for you. If you give us the translation, we cannot translate in all the languages of the world, but if you provide us with the translation, we will put the translation in the beautiful videos, in the beautiful fact sheets, and we will give them back to you to use. And so I really hope that I have in this little time inspired you to see that parenting is the most important, okay, I'm overselling it, is one of the most important sources of social capital to promote the healthy and safe development of children and youth. And two, we have loads of possibilities and tools available to do that together. Let's join forces and let's go for it. Thank you so very much.
And thank you very much for that, Giovanna. I couldn't agree more when you're talking about, I would go along and say, yes, the most important. Why not? I think they are, and particularly when we can work together as parents, we can achieve a huge amount. I'm going to hand you over now very shortly to Kristina Sperkova, who's going to give us a little bit on the area of peers and where we can bring influence to bear in that space. She's going to be talking particularly about media literacy. But just to tell you a little bit about that background, Christina has a master's degree in psychology from the Comenius University in Slovakia and well over 20 years of experience working in the field of health promotion, particularly in the area of prevention of substance use. In 2014, she was elected president of Movendi International, which is a global social movement for alcohol prevention. There's 134 member organizations in 56 countries around the world, and Christina is also a Planet Youth ambassador. So over to you, Christina.
Thank you very much, Emmet, and thank you everyone who has spoken until now. Wonderful introduction from Iceland and great presentations of what's been done by Yvonne from Kenya and Carlos from Chile, and also, of course, Margaret and Giovanna. And I will continue, and I'm, as you said, Emmet, I am supposed to talk about peers, but I realize like I'm going to talk, and that would be like youth in my understanding, but everyone, I would like, everything or I will be talking about, it will be everyone but youth, because I think it's also very important how the adults in this world, what kind of understanding and what kind of culture we create for young people to perceive the world. And let me just start with this very simple statements, like even a small amount of alcohol is carcinogenic, even a small amount of alcohol shrinks human brain, and even a small amount of alcohol harms human heart. We know this about carcinogenic character of alcohol or nature of alcohol, we know since 1988. But this is not communicated, and I believe even people maybe in this webinar now would question it. And what happens is that alcohol is so strongly normalized in our society that we do not accept in our minds the real harm alcohol causes. And this we can also see what is happening with other substances. So we can see bigger and bigger normalization of cannabis. And of course, like tobacco has been also normalized, but there are better policies for it. And just to present something very interesting from a study that has come out recently, and now I'm moving to the adults and to the peers, so I will actually continue about the importance of parenting. But in this study, they looked at the parents in Norway, Sweden, Finland, and Denmark, and how they perceived alcohol use in front of their kids. And the 91% of Norwegians would not agree with inebriation in the presence of children. 86% of Swedes and 85% of Finns would think the same way. So they would think parents should not use alcohol in front of kids. Compared to that, a rather smaller amount of Danish parents would think, so only 69%. And the difference between these countries is also alcohol policy. And one of the conclusions of this study is also how much also alcohol policies are making us aware of also our consumption of the substances, but also about the harm that the substances are causing, because Norwegian, Swedish, and Finnish there is a stronger alcohol policy when it comes to Norway, Sweden, and Finland compared to Danes, to Denmark. And in this, if I just put it then in this context, then it's very important also to talk really about the normalization of substances and like how to deal with that, because they are creating in a way our understanding and perception of what is happening around us. So the normalization is influencing it. And for example, we know that young children know already when being 4 how to use alcohol and like what kind of effect alcohol has. They know how to pretend being drunk, for example. So, and like knowing this also makes them more open to using the substances. So there are programs and there are information campaigns, but then when we see the cultures, this and how people around behave, that actually in the end influences the behavior of the children. So, and in this situation also very, very strong role is played by alcohol industry. And that's where we are coming also then to young people, like part of the prevention among young people is very important to understand the practices and strategies of the industries. And now I'm talking about alcohol industry, but they are also the same when it comes to tobacco industry. And we can see similar practices coming also when it comes to cannabis industry, for example. And I will present this. There are 5 strategies that we have like categorized, and it's like lobbying. So eliminating any alcohol policy or any policies that would be threatening sales and profits. Then it's promotion of the products or the substances, so making them available and available on all the possible dimensions, so social dimension, psychological dimension, but also physical dimension and financial dimension. Then sabotaging, so avoiding, violating and undermining already existing laws, for example, tax evasion. That's what the industry is doing to normalize the products in the society. And the manipulation, so it's different, like controlling and protecting and cultivating the image of the product to, like, for example, greenwashing or pinkwashing, corporate social responsibility, and deception. So it's actually spreading lies about the product and hindering the public recognition of the real effects. So, for example, alcohol industry will not tell you that alcohol is carcinogenic. They might try to send that message, pretend that they are sending the message, but they make it so complicated that the receivers will doubt. So, and this is also part of the package what we are using when we are working with young people to really make them aware of this, of the industry practices and how they are forming our understanding and also understanding of adults when it comes to the different substances. And here I will stop, as this is a speed, it's like speed dating. So thank you very much for your attention.
Thank you very much, Christina, for rattling through that with us. I'm sure you could probably give us at least an hour on that, if not a whole lot more, but we'll keep moving swiftly along. I'm going to introduce our final presenter in this section. It's going to be Mate Kosher. I'm just going to find his bio here quickly so that I can introduce him correctly. But Mate is going to be talking a little bit to us about community environment, and that our young people are growing up in the community and social environment. But Mate is the director of Utrip and the coordinator of the national prevention network called Prevention Platform. He's a president of ICARA, and he's the deputy chairperson of the Vienna NGO Committee on Drugs. So over to you, Mate.
Thank you. It's a great pleasure to be with you today at this great side event on social capital, which is a very important topic, obviously. It's also a pleasure for us to be co-sponsors and speakers at the event. But before I start talking about importance of community environment from the perspective of social capital and prevention, let me say something about how we understand prevention today. It's pretty obvious that by focusing on substance or drug use prevention only, we have very limited opportunities to achieve more visible population-based outcomes regarding youth development and their health and well-being at the local and also other levels as well. We live in a world where we have more and more new challenges regarding the risk behaviors of children, young people, and us adults as well. Gone are the days when we focused on 1 or 2 risky behaviors in prevention, as in this case, the effects and outcomes were very limited. Since the mid-90s, approximately mid-90s of previous century, prevention has been focusing more or less successfully on risk and protective factors, which are common to several risky behaviors. So the mantra of modern prevention is therefore the prevention of several risky behaviors, usually at the same time, and very often also at the same locations or settings. Furthermore, this updated public health prevention framework reflects the much wider scope of prevention work we may have been accustomed to so far. And we will certainly need to work strategically in the future to cover the widest possible segment of the population with our policies, programs, and also other interventions, including the most vulnerable populations and groups. And finally, before I switch to community environment specifically, we need to take into account also much broader view of our health and well-being. And in addition to the physical dimension of health, which is mainly our focus in prevention today, equally add other dimensions of so-called optimal health, such as social, emotional, spiritual, and intellectual health. This is especially important in these hectic times of COVID and post-COVID pandemic and several wars and other military conflicts around the world. It is clear that we have a lot of work to do in this regard, but we need, but it's never too late to start. Okay, finally, community environment. Why it is so important, after I explained some basics before and the context of prevention before, why it's so important that communities address substance use, or let's say more widely, risk behavior prevention. Various authorities and levels of government certainly share responsibility for preventing different risk behaviors, including substance use, and promoting the health and well-being of different populations. But communities definitely and clearly have a key role. After all, people live in communities. We work and attend schools, community events, play sports, use local recreational facilities. We shop in local stores, patronize restaurants, bars, other businesses, and participate in spiritual and cultural activities. And this is where the problems actually that arise from the risky behaviors are keenly felt, and the harm as well. So we also know from different research and practice as well that most of prevention interventions at the local level are directed to school environment. Of course, it is important that we focus on schools and prevention due to their influence to promote youth development and reduce substance use and other risky behaviors. However, many other factors fall largely outside the school boundaries. For example, various family factors, which was already mentioned, media influences, also mentioned before, availability of various substances, including the legal ones, such as alcohol and tobacco, access to alternative activities, community attitudes, cultural values, and they need to be addressed by others in the community. Moreover, many of the immediate harms are of concern to the general community. For example, vehicle crashes, vandalism, as are longer-term harms. For example, family, legal, and occupational problems. Just to shorten my presentation a little bit, because international standards were already mentioned, so I will not spend so much time in this. In international standards, you can find very clearly which community initiatives could be effective to use. Especially, it is important that also communities support the enforcement of alcohol, tobacco, and other drug policies. Apply evidence-based interventions tailored to the needs of the target populations. To provide training to different prevention workforce and resources at the community level, so people can implement those evidence-based interventions in the long term. We should also involve researchers and universities to support us in evaluation and monitoring phases, and also sustain prevention interventions as long as possible. And standards tell us that more than 1 year could be a good starting point. And also there is a very nice chart in the international standards as well, where you can clearly see the importance, especially the importance of community-based multi-component initiatives. So more stakeholders together working strategically as a team. It shows that in different developmental phases, we can achieve very good results. So this is really important to mobilize community in prevention work and keep this work as long as possible to achieve several good outcomes at the end. And thank you for attention.
Thank you for that, Matt. I'm just having a quick look at the chat now. As we thought maybe at the outset, we were always going to be very, very tight on time. I don't think we've done too badly. We're 12 minutes past the hour now. And I was monitoring the chat as we were going through, and a lot of the kind of questions that have been asked have been answered quite rapidly and impressively by the speakers through the chat. But just to say, there was a few requests that came through for slides that Margaret presented, and she's quick and on the ball. She's already emailed those in as a PDF. So what we can do is we can get those out to people through the registration attendance list. We can just email that directly out. And we will see about getting other presenter PDFs of other presenter slides out to you as well. I see there was a few requests on the model that came in, and Thorfinnur Skulliston has been very quick to put up the link, and that you can find a link within the chat to the Planet Youth org and a lot of publications related to their model. There's also going to be a conference, I believe, in Reykjavik in September. If anybody wants to go, there'll be a full conference about this whole undertaking that Planet Youth are embarked upon in Iceland in September, and that'll be on their website as well. I see, Christina, that you've put a response in about that question about denormalization of alcohol, and saying if anybody wants to get in touch with you, would you stick your email on the chat there? So, because you're saying to get in touch, there's a whole piece dedicated to that, and I know that there's amazing work that Movendi have been involved in that space. So if anybody wants to find out more, Christina's going to put her email into the chat. The rest of the questions were more or less answered as we go, and I don't want to get too bogged down because we're kind of out of time. There was one that came in as a request about the listen first, and does training happen related to that? And I was just wondering, Giovanna, would you be able to answer that about the listen first? Is that something that you do an online training on at any time during the course of the year? Giovanna, are you still with us? No, she might have to, she might have got cut off or had to go to another meeting. So I think that's it. And this is just one last quick chat here on the chat before I hand you back to Kristen, who's going to wrap things up for us. I can see that Christina has put her email there, and that's done. Okay, so that's all sorted. And how is the Icelandic model financed? That would be something that I think we could take up at another time. That's a question that would go directly. And you can see other people are sticking in their email address there. So monitor the chat there. We're going to wrap things up because we just we're simply out of time. So I'm going to hand you back to Kristen Arnadottir just to finalize this. And just before I do that, to say thank you everybody for attending, an amazing attendance from all over the world. I was looking at the greetings from Australia and Austria and the Philippines, South America, the Americas, Africa, across Europe. We've had an amazing representation from around the world. So thanks again for coming. I hope you found it useful. And just follow up there with anybody that you want to find a bit more information. You'll be able to do that by email and people's websites as well. So, and thanks everybody, and over to you, Kristen.
Thank you very much, Emma. I think you said it all. And of course, very valuable to hear all the different views here. And since we are running out of time and have even run out of time, I just want to say that I hope you have all found it valuable to meet and discuss today. And despite people from all over the world, they are attending the session, which was really impressive. And I thank our collaborators and participants at the UNODC, which has its headquarters here in Vienna, for providing us with this great platform. I hope this was an important step to be bringing us closer and further in coordinating our cooperation. And thank you very much, and wish you all the best.
Thanks, Kristen, and thanks again, everybody.